Hi, my name is Emma DeYoung. I'm going to do my head-to-toe assessment. First, I'm going to scan the room. Show me that there's no other people. Okay. Hi, my name is Emma. I'm going to be your nurse today. How are you? Great. Good. I'm going to wash my hands and pull the curtain for some privacy. Okay, so can you tell me your name and date of birth?
Jessica Snyder, 7/4/96.
Okay, so her age appears as stated. Can you tell me where you are?
I'm at the hospital, I think.
And what year is it?
2016.
Okay, so my patient is alert and oriented ×3, which is great. Her hygiene seems to be normal. She's clean. She doesn't smell bad. She has no signs of illness. Her mood seems to be good. She's in a good mood. Her speech is clear, and her affect matches her body language, so that's great. So now I'm gonna do a head-to-toe assessment on you, if that's okay.
That's fine.
Okay, so now I'm going to start with her head and neck. I'm going to start looking at her hair and checking to see if her hair distribution is good. She has no weird bumps or bruises or anything abnormal that I should be concerned with. And then I'm going to look at her face, and her face is symmetric, and check her temperature. Her temperature is fine, not hot or cold. I'm going to check for lesions or moles, and if I see a lesion or mole, we're going to go through the ABCDEs, which stand for asymmetry, and we want the moles to be symmetric, not asymmetrical. We want there to be regular borders, not irregular borders. We want them to be normal color, so not red or purple or blue. We want the diameter to be a small diameter, and we want the moles not to be elevated. But she has no moles, so we don't have to worry about that. And now I'm going to do your eyes. So your eyes are symmetrical. Your conjunctiva are pink and moist, which is normal. And now I'm going to go through the perla, which stands for pupils are equal, and just by looking at them, they look equal. They're both round, and I'm going to check her reflex to light. So look at my finger. And both her pupils constrict when I put light on them, which is good. And now you follow my pen light with your eyes, not your head. Okay, so her movements are all really great. And that's really, her eyes are normal. So now I'm going to go to her mouth and check her, can you open up your mouth for me? Will you say Okay. Her uvula rises when I check that, and will you move your tongue for me? Okay, so her tongue moves. Her gums look moist and pink, so that's awesome. Your teeth have no dental work, and her tonsils I would rate as a 2+. And one more thing, we're going to check with your eyes. We're going to check for accommodation, and so that just means when you focus, so just look at my pen light and focus in on it. Okay, so her accommodation is great. And then so I checked all her inside her mouth, and it all looks normal. I'm going to check for her cranial nerves 5 and 7, and so will you puff your cheeks out for me? And smile? And frown? Okay, so all her cranial nerve 5 and 7 are intact, which is the motor and sensory nerves. So now I'm going to assess her carotid pulse in her neck. Inspect first, so feel for it on both sides. Okay, and now I'm going to listen with the bell of my stethoscope for bruits. Okay, so there are no bruit sounds, so Her carotid pulses feel good, and I would rate them at a 3+. Now I'm gonna move on to her upper extremities. So I'm gonna check for symmetry in her arms. Feel for temperature. Her temperature's good. She has no lesions or moles that we need to be aware of, but if she did, we would go through the ABCDs again. But now I'm going to feel for her brachial and radial pulses, so feel for them in both arms. Now checking for her radial pulses. And all her pulses are there and +3. They're very normal. So now I'm going to check for her cap refill on all her hands, fingers. So her capillaries refill under 3 seconds, which is normal. And then I'm going to check for clubbing in her nails, which we're looking for rounded nails, but her nails are flat, so she has no signs of clubbing. And now I'm going to do your hand grip. So can you squeeze my hands hard as you can? Thank you. So her hand grip is fine. And before I move on to the heart and lungs, I'm going to check for JVD. So can you turn your head to the left? So none there. And turn your head to the right. And none there. So she has no JVD present. So now I'm going to move on to her heart. And what we want to do is listen in 5 spots. So these are the 5 spots that we're going to listen to. So her aortic, her pulmonic, her Erb's point, which is where we would hear murmurs in the heart, her tricuspid, and her mitral, which is where we would hear the apical rate for 60 seconds, but for the sake of this video, I'm just going to tell you that I will listen. So now I'm going to listen to each of those spots and listen for a regular heartbeat with the diaphragm of my stethoscope. And this is where I would listen for the apical heart rate. Okay, so now I'm going to go back up, listening with the bell of my stethoscope after I got the apical heart rate. So listening all the way back up. So her heartbeat is regular and there are no murmurs present. So now I'm going to listen to her lung sounds, and we do 8 on the front and 10 on the back and 2 on each lateral side. So I'm going to ask her to take deep breaths for me at every location. All right, deep breath for me. Deep breath for me. Deep breath for me again. All right, and another deep breath. Another deep breath. Another deep breath. Another deep breath. And another one. Okay, and then can you turn to that side for me and lift your arm up? And then another deep breath. And another one. You okay?
Yeah.
All right. And then turn the other way for me. And then another one. And then another one. Okay. And then turn, to your back. All right. Take another deep breath. And another one. And then 2 more. Okay, so her breath sounds are clear. I don't hear any wheezing or anything like that. So her lung sounds are awesome. So now I'm gonna check for her costovertebral angle, and I'm gonna percuss this. So tell me if you feel any pain with this, okay?
No pain.
Okay. And now I'm going to assess for her alignment. So can you bend over? And I'm going to check her vertebrae, and it's in a straight line, so that's good. Okay, and now I'm going to assess for her her diameter, so it's 2 to 1, which is great. So I'm checking for barrel chest, which she doesn't have. Okay, so you can sit back down for me. So now I'm going to do her abdominal assessment, and I'm going to go through the quadrants and tell you what's in each quadrant. So this is the right upper quadrant, and the liver and gallbladder are found here. The left upper quadrant has the stomach and spleen. The left lower quadrant has the left ureter and left ovary. The right lower has the right ovary and right ureter. So now I'm going to inspect. So she has no lesions. Her skin is clear. There's no scars. Her contour is flat. She has a very flat stomach. And her inspection looks great. And so now it's all symmetrical. And so now I'm going to listen for bowel sounds. And I'm going to make sure that they're present, because if they aren't present, that can indicate constipation. So I'm going to listen in each quadrant. Okay, and now I'm going to percuss in each quadrant because the bowel sounds were present, so she doesn't have any constipation. So tell me if this hurts, okay? Any pain?
No pain.
Okay. So when we percuss, in the right upper quadrant, we usually hear a dull sound because the liver is there, and all the other 3 are tympanic sounds because they're more of empty space in the abdomen. So now I'm gonna palpate and let me know if again there's any tenderness or pain. Okay?
Okay. No pain.
Okay. So now I'm going to move on to her lower extremity, and I'm going to assess for symmetry in her legs. I'm going to make sure that she has no edema. She has no lesions. Again, if we saw any, I would do the ABCs, ABCDEs. And I'm going to feel for her pulses. And so I'm going to feel for her dorsalis pedis, which are in the foot. And I'm going to feel on both legs, or both feet. And then I'm going to feel for her tibial pulses. And these are on the inside of your foot, near the back of the ankle. So those are present. And then I'm going to feel for her popliteal pulses, which are behind the knees. Okay. And I'm going to rate all of these as a 3+. And now I'm going to do the Babinski test, which is testing for reflexes in the foot, and we're making sure to see that her toes spread apart. So, thanks. I'm just going to take them off for you. All right, so I'm just going to drag my pen up along the edge of the feet. And both feet reflex, and both all the toes spread apart, so her reflexes are there and present. So now I'm gonna do the stand, sit, and walk part of the assessment, and these include 2 tests. One called the Romberg, and this is gonna have my patient stand up, and have her feet spread apart and her hands by her side and her eyes closed for 20 seconds, and I'm going to make sure that she doesn't sway or have any dizziness. Okay, good job. So she had a little bit of swaying, but that's pretty normal. She didn't fall over or anything, so that's good. And now I'm going to do the get up and go test. And this is when she starts sitting, and then she's going to get up and walk 10 feet and come back and sit back down. And I'm going to assess her gait here and to make sure that she can walk steadily. So go. And her gait is steady. So that concludes my head to toe assessment, and thanks for being my patient.